people with disabilities.
Sorry, Mr. Chair, I don't think, Modesto, have we connected yet?
We haven't connected yet. If you're ready, let me just check with Channel 64, and I have to check with ASL as well. Please give me a moment.
I apologize. I was a little too quick to the gun. Good morning. This is the Council Committee on People with Disabilities and Special Needs for today's important hearing for Friday, March 5th, 2021. I understand that state law currently requires that the following announcement be made at the beginning of every remote public hearing as follows. Due to the current public health emergency, City Council committees are currently meeting remotely. We're using Microsoft Teams to make these remote hearings possible. Instructions for how the public may view and offer public testimony at public hearings of council committees are included in the public hearing notices that are published in the Daily News, Inquirer, and Legal Intelligencer prior to the hearings, and can also be found on phlcouncil.com. I now note that the hour has come. Mr. Iannuzzi, will you please call the roll to take attendance? Members of the committee that are in attendance, please indicate that you are present when your name is called. Also, please say a few brief words like how you're doing today when responding so that your image will be displayed on screen when you speak. Thank you, Mr. Iannuzzi.
Councilmember Bass. Councilmember Brooks.
Mr. Chairman, this is Councilwoman Bass. I apologize. I had technical difficulties. I'm present.
No problem. Thank you.
Thank you.
Councilmember Brooks.
Present.
Thank you.
Councilmember Gautier. Councilmember Gilmore Richardson.
Good morning, Mr. Chair. Good morning, colleagues.
Thank you. Good morning.
And Chair Green.
I am present. I do know that Councilmember Gim will be here shortly, and I know we saw Councilmember Gautier here earlier. Also, I do just want to note for the public that ASL is also ready and should be providing information as we continue with the hearing. With that, I want to thank everyone for being here. A quorum of the committee is present and this hearing is now called to order. As I stated earlier, this is the public hearing of the Committee of People with Disabilities and Special Needs regarding resolution number 210128. Mr. Iannuzzi, will you please read the title of today's resolution?
Resolution number 210128, resolution authorizing the Committee on People with Disabilities and Special Needs to hold hearings regarding services for people with disabilities and general compliance with and enforcement of the Americans with Disabilities Act.
Thank you, Mr. Iannuzzi. Before we begin to hear testimony from the witnesses we have here for today, everyone who has been invited to the meeting to testify should be aware that this public hearing is being recorded. Because the hearing is public, participants and viewers have no reasonable expectation of privacy, by continuing to be in the hearing, you are consenting to being recorded. Additionally, and prior to recognizing members for any question or comments they may have for witnesses, I will note for the record at this time that we will use the chat feature available on Microsoft Teams to allow members to signify that they wish to be recognized. In order to comply with the Sunshine Act, the chat feature must only be used for this purpose. Mr. Iannuzzi, can you call the first panel or witness we have to testify this morning?
Adrian Ewing.
Thank you, Mr. Iannuzzi. Good morning. Is there any questions or comments from members of council before we start this hearing? Seeing and hearing none, I want to thank my colleagues for being here. Also want to thank the public for participating in this important hearing. This hearing is very important because we need to make sure that everyone within the city of Philadelphia, regardless if they have any physical or learning difference, has full access to the city. And so this ADA transition plan has been in the works for some time. And so now we're moving forward with the transition plan to make sure that we make the city of Philadelphia fully accommodating in all possible ways. We know we have a lot of work to do. It's going to take a significant amount of time to make sure that we are fully compliant with the Americans with Disability Act. But I think today's hearing is a conversation, an opportunity to provide the public with the plan from the administration and provide some feedback and other perspectives to continue this work, which we know will be a work in progress, but it's so important to make sure that all citizens in our city have the ability to benefit from all the opportunities that we have here in the city of brotherly love and sisterly effectiveness. With that, we'll have our first panel. Ms. Ewing, please proceed with your testimony.
Good morning. Good morning, Chairperson Green and members of the Committee on the Disabled and Persons with Special Needs. My name is Adrian Ewing, and I am the Director of ADA Compliance in the Mayor's Office for People with Disabilities. Thank you for the opportunity to testify on the self-evaluation and transition plan required by Title II of the Americans with Disabilities Act, or the ADA. This prohibits discrimination against individuals with disabilities in state and local government services. The ADA is a civil rights law that prohibits discrimination and prohibits public entities from excluding or denying individuals with disabilities participation and benefits of the services, programs, or activities of a public entity. The ADA defines a person with a disability as an individual that has a physical or mental impairment that substantially limits the performance of one or more daily life activities. A person that has a record or history of an impairment, or a person that is perceived to have a disability. Roughly 16% of all Philadelphians live with a physical, emotional, or cognitive disability. The Mayor's Office for People on Disabilities is committed to continuing its work to make Philadelphia a more accessible city. To that end, our office has accomplished major goals over the past few years, and today I will be providing more information about the ADA transition plan process and the current status. In 2018, the city engaged Milligan and Company to conduct its self-evaluation and transition plan. This evaluation included a physical barrier review that is comprised of site visits at each of the 537 facilities to determine whether or not there were any ADA compliance issues. This included an assessment of entryways to the facility, doorway widths and speeds, counter heights, and restroom accessibility, just to name a few. The results of the review, which outline each facility that was assessed, along with suggested corrective actions, project prioritization, rough cost estimates, and a long-term schedule are contained in the transition plan. The facilities included were prioritized by equity based on location in minority neighborhoods and low-income neighborhoods that were impacted by disinvestment. The transition plan includes applicable ADA priority levels as follows. Priority 1 is for accessible approach and entrance, accessible path to and through the site, and safety. Priority 2 is access to goods, services, programs, and activities. Priority 3, access to public toilet rooms or restrooms. And priority 4, access to other public amenities such as water fountains and public telephones. In addition to the physical barrier review, the evaluation also included programmatic changes, written policies and procedures to attain better program access for people with disabilities. As a result, an ADA liaison network was created for internal departments within the city. An ADA liaison policy was also developed, which provides ADA training, procedures, and regulations. Additionally, the ADA grievance procedures and form, reasonable accommodation procedures, effective communication policy, and website accessibility policy were developed in accordance with administrative review recommendations. In October 2020, a draft transition plan was released, followed by a 30-day public comment period. During that time, there were 2 public meetings held in November 2020 that allowed residents to make comments and provide feedback, a summary of which was contained in the finalized transition plan released in December of 2020. Formal implementation commenced in January 2021. Recognizing current fiscal realities, ADA corrective actions were prioritized for fiscal years 2022 through fiscal year 2025. The corrective actions listed in the transition plan that are noted as unfunded will be re-reviewed and scheduled during the next 3-year transition plan update. The process to establish formal implementation of the transition plan included meeting with internal departments during the capital budget process. Additionally, there have been meetings with the departments to determine the prioritization of projects, status updates, and timelines. Also, the consultant group is completing the updates to the Geographic Information System software, also known as GIS, that our office will use to track the projects throughout the city. This software will allow our office to identify each facility from the transition plan on a map of the city with overlays of additional information to include identified physical barriers, corrective actions, and timelines. The transition plan will be updated every 3 years, with the next one scheduled for 2024. This administration strives to model diversity and inclusion and is committed to engaging the disabled community to improve access to programs and facilities. The Mayor's Office for People with Disability appreciates the efforts of the committee, and our office continues to take steps to ensure that the city is working towards meeting ADA compliance, using the finalized ADA transition plan as the toolkit for a more inclusive city. I am happy to answer any questions the committee may have, and thank you.
Ms. Ewing, thank you for your testimony. Also want to make a note for the record that we're also joined by Councilmember Jamie Gauthier this morning as well. Ms. Ewing, if you could kind of restate for the record the priorities, just make sure that people have a full understanding. I know we provided a briefing for members of council. One of the goals of this hearing is to provide some information for the public regarding the city's ADA transition plan. So if you could go over those priorities and we kind of go through those in detail.
Yes. So, Councilman Green, and to the other committee members and all who are present today, the facilities that were included in the ADA transition plan were prioritized by equity based on location in certain neighborhoods that included minority neighborhoods and low-income neighborhoods that were impacted by disinvestment. And those priority levels, there are 4. And this is as per applicable ADA priority levels that we used. And they were as follows. Priority 1 is for entryways or access to a facility. For example, as you enter a building or a structure, a site. So that's priority 1. Priority 2 is access to goods and services or programs. So it's how you access the programs that are contained within the building. So that is priority number 2. And priority number 3 is access to public toilet rooms or restrooms. So that would include pathway of travel, accessibility to the restrooms. So that is priority level 3. And finally, priority 4 is access to other public amenities such as water fountains and public telephones. So again, it would also include the route to the water fountains or public telephones, and that is priority level 4.
Okay, thank you for that list of prioritization. And how does that compare to other cities as they were putting together an ADA transition plan?
I cannot speak to other cities specifically. However, those 4 priority levels are as per ADA policy, and that is what we also followed.
Okay. And then you also talked about, as part of the transition plan, there will be liaisons in various departments. Can you talk a little bit about the work of the liaisons? Are these individuals that already have other roles within departments? How will they prioritize ADA compliance? And how will they also work together collectively with your office?
So as far as the ADA liaisons, this was a program that was developed by our past ADA director, and the role of the liaison is for internal departments within the city, and they are trained. They have received training on ADA policy and ADA regulation, and their role internally is to assist employees or others with processes such as the grievance request or reasonable modification. And they work with my office in respect to providing that information, because if they assist an individual filling out one of these requests, it will then come to our office. If they have any questions or concerns, that will also come through my office, as well as meeting quarterly, at least quarterly, for any updates or status changes to ADA policy, for example, that they would need to know, and to give refreshers on training, because sometimes individuals may leave their position, they may leave the city, and another individual is then designated by their department head, and that individual would need training. So that could be either individually or collectively as a group.
Okay. And so what role or impact will liaisons have in the capital budget process for those various departments? You also talked about prioritization and spending, and made reference to the capital budget. And I recall you making a point in reference to some of the challenges we're currently going through with the current budget process. So can you give some perspective regarding those 4 prioritization areas, and maybe use a specific department on how under the 4 prioritization areas as we're going into the FY22 capital budget, capital program, how the ADA transition plan will be part of that conversation.
With regards to prioritization and the capital budget process, the liaisons themselves are not directly involved in that process. That would include the department heads. And so we have worked with the departments to prioritize projects, and given current fiscal challenges due to COVID, these priorities, for example, I'll just give an example. If there's a location, a facility listed in the ADA transition plan that might be listed, let's say, as priority 2. Mm-hmm. Priority 2 is access to goods and services. So in lay terms, that would mean that when an individual goes to that location, they may not be able to access the programs there. Maybe the program that they would want to access is on a second floor, and maybe there's no accessible route, no elevator, for example, hypothetically speaking. So our work would be to prioritize that priority 2. It may become a priority 1 in our review because, for example, location, equity. Those are some of the considerations, or if it's located in a neighborhood with disinvestment. Those would not change the status of the priority according to ADA, but under our review, it would be given further consideration with those other challenges, and therefore it may move up on our list of prioritization during the capital budget process. I hope I answered. Mm-hmm. Did I answer everything?
Yes, and I would also like to know for the record that we've been joined by committee member, Councilmember Helen Gim. Also, in that regard, through the capital program as well the capital budget, will projects be identified as ADA projects or projects that this project for this capital investment is in keeping with the city's ADA transition plan? So for members of council, as we're going through the budget process and we're looking at both the capital budget and the capital program, how will projects be identified in this budget process that this is a project that is helping the city meet its goals under the ADA transition plan?
I just want to review your question. So you're asking how are projects prioritized during the capital budget process?
Well, you gave a little perspective. I'm saying how will it be identified?
How will it be identified? Okay.
As we receive the capital program, capital budget, we see the information and we have various departments, but will there be some information in the narrative for you guys projects that are in the capital program or capital budget that will let council members know, or just the general public that happens to review the capital budget program, that this investment in this elevator or escalator or some other capital investment is in keeping with the city's ADA transition plan and it's under prioritization number 1, entryways, or 2, goods and services, or 3, public accommodations, or 4 other public amenities? I mean, will there be some type of categorization within the capital budget so that as we're going through the budget or the capital program, we know that this is for that perspective?
Okay, thank you for clarifying. Yes. So the transition plan outlines each facility, and each facility has a category that falls under one of those prioritizations. So that information is what the capital budget will use when determining cost availability for the project, for example. And then my office participated in the capital budget process as we are heading into fiscal year 2022. So we were able to push certain projects for priority. And I just want to also note that the same information that has the prioritization is what was presented to capital budget. That's one aspect. And then the other aspect is that there are some projects that did not require capital budget for corrective actions. They may have been low to no cost considerations that could be resolved with in-house employees, such as, I'll give an example, adjusting a counter height, for example, let's say at a library. Creating an accessible counter height at some portion, let's say where the checkout is, or adjusting the height of a handrail or a door speed. Those are things that would not require. So I just want to clarify that not all of the 537 projects required capital funding.
I just think it would be good as part of the process as you talk with the capital program office and administration, and probably Mercer Waxman as budget director and Rob DeVoe as our finance director, that information is included in the capital program budget, so we know that yes, this is a project that has a need for capital investment by this various department, but also this project is being done in a way that not only does the department believe we need to make the investment, but this investment is also keeping with the city's ADA transition plan, and it's going
absolutely
criteria. I think having that information in the capital budget process and in the capital budget,
absolutely
gives a perspective of how we're moving forward in the ADA transition plan and bring it to completion. You mentioned, I think you said a number of 537 projects.
Yes, there were 537 facilities that were assessed during the self-evaluation and transition plan. And that includes physical buildings, parks and recs, libraries, some historic structures, etc. So some of these locations may be outdoors, like playgrounds.
Right, and I know Councilmember Bass was instrumental in, as chair of Parks and Recreation Committee, in passing legislation a few years ago in reference to making sure that our newer investments in parks and recreation centers, and this is prior to rebuild, have investments and also have a perspective of having sensory and other adjustments to make sure that they are fully adaptable for people with all different backgrounds and perspectives. And that was, even prior to the city completing the ADA transition. In that perspective, in reference to sensory dynamics, how does the transition plan also help those that not only have physical differences, but learning differences as well? Because that is also part of the American with Disabilities Act.
Yes, and that is where the programmatic and policy changes came into place, along with working with Rebuild. For some of their projects overlap with Parks and Recs, and they are making some adaptations in playgrounds to be more inclusive with sensory activities for those who may have cognitive impairments. And so there are some projects, and we are working with them moving forward, because the goal is to have a more inclusive city, including these sensory challenges. Even libraries. And again, it connects with programmatic access, programmatic and services and changes that can make the facility more inclusive. So it's not just, as you mentioned, physical barriers. There are also programmatic changes that need to take place. And so we are at the table talking with the departments about all of these concerns. The ADA transition plan does suggest corrective actions as well for programmatic concerns.
Yeah, I asked that question not only because that is part of the American with Disabilities Act, but also when I look at your areas of prioritization, when you talk about goods and services. Yes, for some, being able to access goods and services, there needs to be adaptations that need to be made in order for them to physically participate in those goods and services. But those that have a learning difference, we also should be focused on how they can access various goods and services, as well
Absolutely.
as the public accommodations and other amenities that the city provides.
Absolutely. And I just want to also mention that the reasonable modification policy and form was also revised during this process. And we encourage individuals to use those in circumstances where it can be applied. If there's enough time, let's say a few days within an event or a service, that these reasonable modifications can be made to accommodate a person who may need, for example, a American Sign Language interpreter.
And also, you said that the ADA transition plan will be updated. I think you said every 3 years?
Every 3 years. Yes, that's correct.
And will it be the same process using a consultant, an outside consultant helping to update that, or is that going to be more internal, or that's yet to be determined?
That is yet to be determined. I cannot really speak to how the process will be, but the fundamentals of the process will be similar as far as evaluating all of the facilities again, even the ones that may have had, for example, priority level 0, which I did not mention. Those were sites that were visited, and they did not have any ADA compliance issues at the time of the site visit. However, in 3 years, as we know, all buildings, all facilities will have maintenance issues over a given period of time. So they will be reevaluated. And if they are found to have any issues, it could be a door speed that has become too fast or too slow. It could be anything that has changed that could cause issues to create a physical barrier or programmatic access challenge to individuals visiting the location. They will then be reevaluated and prioritized accordingly as such.
And then I see both council members, Kendra Brooks and Councilmember Hellingen, have questions, and we'll proceed to their questions in that order. But I have one other question I wanted to ask. Are you coordinating with other agencies that are within the city of Philadelphia that may not be wholly owned by the city of Philadelphia, for example, SEPTA or other agencies, and talking with them in reference to what type of steps they're making from a capital investment, from a transition, or compliance with ADA?
At this time, I cannot really speak to that. However, the ADA transition plan did not include transportation services like SEPTA, and that is because they are their own entity and they are responsible to adhere to ADA regulations separately themselves. But at this time, I cannot speak to our office working in collaboration with other city agencies. The transition plan is just focused on Title II. Transportation is a different title. And so at this time, I can't speak to what the city may plan to do down the line or anything to that end.
And I understand that transportation is Title II, but some of the same investments they're making in reference to entryways and access to goods and services are things that we could learn from what SEPTA is doing, possibly, as they are also responsible for providing being compliant with the Americans with Disability Act. So I think it would be prudent to talk with representatives at SEPTA in reference to where they are in reference to compliance with Americans with Disability Act. because it could provide some information that could be helpful as we are moving forward in making capital investments for the city of Philadelphia in this regard.
And I will take that back to the table, and we will take all the suggestions into consideration.
Okay. With
Thank you.
All right, thank you. I'm adjourned. I should recognize Councilmember Kendra Brooks for questions. Councilmember Brooks. We'll give it a few moments. I also know that we do have Councilmember Gim who also has a question as well. At this point, let's transition to Councilmember Gim and we'll return back to Councilmember Brooks. Councilmember Gim.
Yes, thank you, Mr. Chair, and appreciate this important conversation. I also want to thank Ms. Ewing. Thank you for the, for being here to answer some of the questions. For clarity, the report said that the city reviewed the 537 facilities. Is that correct? And of those facilities that it reviewed, it said that 55 were found to have no accessibility issues. So you mean that 90% do have problems with accessibility? Is that correct?
Yes, there were 55 facilities that were found to have no ADA compliance issues at the time of the site visit, as I mentioned a little earlier with Councilmember Green. And this is an older city. Many of the structures were built between 1900 and 1960, and so therefore many of the buildings, being older structures, did have compliance issues.
Okay, so 55 are fine.
Yes, okay. As the date of the site visit. Mm-hmm.
Can you give some, can you give some examples of the range of problems that exist at the facilities? So how serious? I mean, they've talked about a range of different areas in parts of the report, but could you, what are the more serious issues, and how are you how are you looking at the facilities that have the most serious issues? So maybe give us a range first of the kinds of problems, and then how you're looking at it both by usage and by specifics. I see the short-term maintenance recommendations, but interested in hearing what you think are the more serious ones.
Well, after the evaluation of the facilities and the prioritization along with suggested corrective actions, I would say that according to the plan and according to the findings of the review, some of the more serious issues would have included a building, for example, that did not have access to programs on other levels of the building, perhaps maybe issues with an elevator, for example, a lack of elevator, or a lack of access to all individuals within the building. And I'm sorry, Council Member, could you repeat the other portion of your question?
I mean, I guess, there are a few of the buildings, and I'm kind of going through the list one by one as I'm, looking at it, that have, major issues. But how are you handling ones where there is almost, it poses like a major issue? Like there's no ramp, for example, so anyone in a wheelchair would not be accessible. There isn't, I'm looking at ones where like even the basic entry into the building would be difficult or impossible for somebody who would require need. How are those being prioritized?
So those would have a priority 1 level. So it would fall under accessible approach. So that that priority level would be listed alongside the facility. And then also we would look at the location of the facility. And then there's also the funding aspect. So some of the projects have been funded under capital budget or operating budget. And those will have to be scheduled under a timeline. So some of those projects, some low to no cost maintenance repairs have already been completed or are in the stage of completion or in progress. Whereas the larger projects, some of those projects are scheduled or on a timeline longer term. And then there are projects that were not funded yet, which will have to be reevaluated. But larger projects, as you mentioned, for example, a curb ramp. Now, we did not handle, I just want to note, this transition plan did not handle street curb ramps unless they were directly connected to the facility itself. So this transition plan does not cover all of the street ramps, throughout the city is basically what I wanted to say. So if the access into the building is inaccessible and requires a ramp, then there were cost estimates provided in the transition plan for the approximate funding that would be required for that project. And then we are working with the departments to schedule out that work. And that will be scheduled out. The projects that have funding, the schedule is over the next 3 years. And then at that point, the process has to be started again, because every 3 years we are required under ADA to have another self-evaluation.
So, under ADA, which was implemented decades ago, if we do a self-evaluation every 3 years, but 90% of our facilities are out of compliance or could have serious accessibility issues, how are you seeing this work moving forward in a bolder way?
I see this as a toolkit. This is our first transition plan. Yes, it is decades late. The ADA was implemented 30 years ago. So Philadelphia came in a little later, but our current administration has been working and striving towards that end to make our city more accessible. It is late, but it is doable, and we're starting one step at a time. So I see the transition plan that we just completed as our guide going forward, and it does contain a lot of work. As I mentioned earlier, this is an older city, but many other older cities have accomplished it. Excuse me. This is not something that will happen overnight. It's something that will take time, and it's going to take funding and planning, and that is what we are currently working towards.
Do you know how many facilities currently are in that the category that you mentioned, which was tier 1 or approach? I'm not using the right terminology, but you can't get into the building.
I do not have that information at my disposal right now, but I can get that to you afterwards.
Okay. And, we'll look through you do have things listed report by report, but it would be helpful to see where those buildings are. But if we could do that maybe separately, and if you could send it over to the chair by building, that would be really helpful.
Okay.
My last question is, how many people are currently staffed in the ADA compliance office currently?
Currently, the office includes myself, the director of ADA compliance, and then we have a constituent liaison. And our executive director role is currently going through the interview process. And so we do not have that role filled at this time.
We've asked this question before. Do you know how that compares to other cities like Chicago and New York?
I do not have that information available at this time, but I can do some, try to gather that information and provide it for you.
Well, Ms. Ewing, thank you very much for your work. I think we've asked this question before, but I think we are far below other large cities have been.
It's okay.
And, part of it is that this is a gargantuan job, and we certainly appreciate the work that went into the assessment of the facilities. That's very, very important, and glad to hear that we have the assessment. We're hoping that we can continue to support a robust ADA compliance office so that we can get this work going. But thank you very much. Thank you, Mr. Chair.
Thank you, Council Member.
And following up on what Councilmember Gim suggested, in addition to having communications with other entities within the city of Philadelphia, like SEPTA, I think, as she said and as I said earlier, I'm also reaching out to other jurisdictions, especially jurisdictions that have more seasoned cities like Philadelphia or seasoned infrastructure like Philadelphia. Primarily, I would think cities on the eastern seaboard, like a Boston or Washington, D.C. or Richmond or New York or Newark, that have had comparable challenges, and see where they are in reference to compliance with Americans with Disabilities Act. I also wanted to ask
Thank you. Yes. Mm-hmm.
In reference to how does the transition plan deal with situations when you have changes of uses of a facility, and what may have been a traditional use may have been shifted because of an emergency situation. I'm thinking primarily right now regarding the convention center. We are now using that for a mass vaccination site with FEMA. Actually, I was just there this morning, and I actually have a tour, I believe, next week. And so I want to get some perspective. How do we make sure that when we're using facilities and locations in a different use than normal, that we're still making sure they are still ADA compliant? Because we may not be using them in a traditional way, we may be making some modifications. And I'm curious if there's been any type of thought of how that still can be compliant with Americans with Disabilities Act when we have some different uses than the traditional use.
That's a very good question. I cannot speak to everything regarding that question, but when a building, and the convention center is a newer building, so therefore that structure should already be meeting compliance. However, with a change in usage, as you mentioned, which is a very good point, there may be some specific compliance issues that may not have been addressed originally because of the change of usage. So I cannot speak to how that is being addressed currently, but the basic priorities that I listed earlier through 1 through 4 should still be the same, regardless of use. Accessible approach, access to services and goods and programs, which the convention center should have, but I can't speak to that 100%. So I won't. But as I said, in a generally speaking, as per the ADA, that location should still have the core tenets in place to meet compliance.
Yeah, I raised that question because we've gone through, and now in fact council just acknowledged a memorial for those who have transitioned and suffered due to the COVID-19 pandemic. And so thinking about various amenities and entryways and access to goods and services that traditionally have been provided one way, but due to the pandemic, things have shifted. Newer buildings like the convention center will probably have less of a problem, or court buildings like the criminal justice center or the family courthouse. But for example, City Hall or municipal services building, or those who are going to library services or voting, we've had to make changes due to the pandemic and restrict access to stop the spread of the disease and need more space to do certain things with physical distancing and other dynamics and physical barriers. And so that's something that none of us could have contemplated March or February of last year or earlier. And so I think going forward, as we're doing this implementation of this transition plan, we have to be flexible in the sense that as we're using buildings in different ways, that we've got to make changes. We are adaptable to that. And so has there been any conversations or thoughts in reference to talking with any of our emergency management systems or Office of Emergency Management in that regard, that buildings that are set up, especially our more seasoned buildings, I'll say, that were structured one way for access, and we're making these capital investments, but then for various emergency situations, we may have to make a transition, and making sure that the transition that we're making due to the emergency still has the access and meets the priorities that you listed earlier as part of the transition plan for ADA.
I can't really speak to what the city is doing with regards to adapting to these changes, as you mentioned. I can only speak to the transition plan that my office is working on, but you raised an excellent point. And to that end, absolutely, when we reassess in 3 years, this is definitely going to play a large part in that reassessment, looking at adaptability within these structures for emergencies. But again, as I said earlier, the tenant focus of the ADA with regards to priority levels should still be the foundation, is what I'm basically trying to say, regardless of usage. Even if certain entrances may be restricted. Now, accessibility may become an issue in some of these adaptations. For example, a building may decide not to use certain entrances and use other entrances that may not be accessible. But then you're absolutely right. That needs to be a talk with the table with the right people to say, no, we cannot do that because it will not provide accessibility to all. So you're absolutely right. And these are the kinds of conversations that we should be having. I can't speak to whether or not the city is, I would assume they are, but I personally haven't been involved in those conversations. So I can't really speak to, how that is being handled.
Okay, thank you. I want to acknowledge that we are also been joined by Councilmember Isaiah Thomas. I know Councilmember Kendra Brooks was having some technology issues. I want to check to see if she's been able to come back, because I know she did have a question. I think we're still waiting for her. So I'm going to ask Councilmember Kim to be recognized, because I know she has a follow-up question.
Okay.
Hello. So the list that we have of the 537 facilities is not a comprehensive list. Is that correct? This is not all our buildings.
These are all the buildings that agreed to participate in the self-evaluation under the city. So these include leased facilities as well. Certain courts may not have been included. They may have opted out. And then there are certain entities that are basically responsible to contain their own or conduct rather their own self-evaluation and transition plan. Mm-hmm. So they were not required to come in with ours, and they can do their own. They may be federally funded, and therefore they can do their own assessment.
I'm interested in, as we're kind of talking about priorities here, areas of priority seem to be places where people need, certainly every building is a priority, and every building needs to be ADA compliant, clearly. But I'm wondering about like our health centers and police stations, situations where people with disabilities, could pose a danger for them, even greater than, maybe in the particular situation that they're in, to be denied access to a health center, for example, or to a police station seems serious. So I guess one of the questions is that it looks like only a few health centers are included and a couple of the police districts. Is there, do you know, whether there's an interest in requiring participation by places where people would need emergency assistance or should be, must be able to have accessibility issues for their own health and safety? So that would be one question. And then two, is there, I think the ones that are participating from the police, I think there's the auto impound lot is a priority one. There's a couple that are priority two, which is an issue, but without having like a full comprehensive look at every single police district, it seems like that should be a priority for the city as well as the health centers. Have you had any conversations with the city about it, or what is our ability to do an assessment on ADA compliance for health centers and for police stations in particular, district police stations?
There were some health centers assessed in the transition plan, and those health centers, I believe there may have been about 9. They have all had some upgrades with regards to the types of beds that they have in examination rooms. As far as further assessment, the ones that we assessed were prioritized, again, with the same 1 through 4 priority levels accordingly. And I cannot speak to whether or not the health department wants to conduct their own assessment or where they may be with that. As far as the police, that as well, I cannot speak to what their plans may be as far as conducting their own assessment. But the 537 facilities and sites, locations that were included in the transition plan, those were included before my coming on board. So, I can only speak to those. So unfortunately, I don't think I can completely answer your question as a result of that. But I can take it back to the table and this can be an offline conversation down the line. I'm totally open to that.
Yeah, no, I just think maybe this is a conversation within the committee that it does feel like there should be ADA, or there should be an evaluation of health centers and district police stations, because a physical barrier to individuals, and to make sure it's comprehensive, could pose a danger to their immediate health and safety, and that would be as unacceptable as they're being blocked from other places of participation. So I just want us to figure out how to tier this a little bit and have a better understanding of why we didn't do a comprehensive review of all district police stations and all the health centers. And if not, whether that can be one of the areas that we certainly push to request for the committee. My last follow-up request is, could you send over the self-evaluation and transition plan as a Excel spreadsheet so that we can manipulate, like a little bit about the ADA priority and track it a little bit better?
Yes, I can send that. Mm-hmm.
Okay, thank you very much.
Thank you, Council Member. Mm-hmm.
Thank you. We have been joined back by Councilmember Kendra Brooks, who also has a question.
Thank you so much. Thank you, Ms. Nguyen, for being here. So you mentioned about the 66 facilities that are priority one out of the 537 buildings that were assessed. And I appreciate the department's, prioritizing, facilities by equity. And I understand that they also took a look at locations in low income neighborhoods.
Yes, that's correct.
How community members engage in the decision making process as to what methods were used, and also what methods were used with communities, especially the ones that are harder to reach in some of those neighborhoods that are considered priority.
I cannot speak to the methods that were used. I was not with the city at that time during that process. So I cannot speak to that.
So my line of question is mainly around when we talk about the physical barriers, which are, needs for capital improvement. There are also barriers when we do adaptations and no one in the building knows it's there. So that's why I was just trying to understand what work was done, with people barriers towards ADA compliance. And is that something within your wheelhouse as the director of ADA compliance? Do you also handle the more interpersonal barriers around ADA compliance in city buildings? Like how people use the building?
We do handle effective communication, and our effective communication policy was updated during this process. But I'm not sure I'm getting 100%. Are you asking how was the community engaged during the self-evaluation process?
Or if they were like community members that have used these particular facilities have barriers where they include the conversation. Because as a person that does not use or need to use it, you wouldn't know there's a barrier if you didn't have to actually access it. So, that's kind of where I'm getting.
Okay. Thank you for clarifying, Council Member. I cannot speak to how the community may have been engaged during that process, or the disabled community in particular, I think is what you're really asking, because they are the ones who may have the physical barriers, for example, into buildings, and how it is perceived to them, what their take on it is. I cannot speak to that, unfortunately. I'm a newer person to this role, and all of that work, as far as the site visits that were included in the review, had already been completed.
Okay. All right, so I'll stick to the facility question. So I know you said that they are scheduled to be updated between fiscal year 22 and 25. Based on my facility, is that what I heard clearly? My computer was going off and on.
Okay.
So I heard some things I didn't, so I'm just backing up. So my question is, do we plan on updating 15 facilities a year? Is that what I heard? And can you clarify or provide insight into which facilities were funded to be done in fiscal year 22?
So the transition plan under ADA is going to be reevaluated every 3 years. So it's going to be reevaluated in 2024. So not 2022. So that, I think that was the first part of your question. And what was the second part of your question again?
Like, just clarify or insight into which facilities are funded to be updated currently. Like, are we still on track to do the updates currently?
So we're still in fiscal year 21, and we will be entering fiscal year 2022, and we have been working with the departments and the capital budget process to try and ensure funding for the projects going into 2022 that may not have been funded previously. So we are in the process currently.
Okay, because I just really wanted to make sure that I kind of want to reiterate the urgency of Chairman Green around, the more detailed information around the capital budget, because you mentioned a huge part of making our city inclusive. And, in order for us to help fight the stigma against folks with disabilities, we have to make sure that, our public spaces, are as accessible as possible. That's why I was asking, like, the more practical using or the more practical barriers that we would not understand as folks that don't have any level of disability visible. So that was kind of my line of questioning. But I want to thank you for providing this information.
Thank you.
And I probably would like to take a deeper dive with you at a later date.
Absolutely. Thank you, Council Member. And thank you to all the members who have given suggestions today. And absolutely, I would be open to going deeper into conversation with the committee in the future. Mm-hmm.
Thank you, Chairman Green.
Thank you, Councilmember Brooks. If there's no other questions for Ms. Ewing, I'd like to move to the next panel, but we may need to return back to you, Ms. Ewing, if there's any additional follow-up questions from members of council based on other witnesses and other questions that may arise. With that, Mr. Iannuzzi, if you can call the next witnesses for panel number 2.
Dr. Wendy Ross, Director at the Jefferson Health Center for Autism and Neurodiversity, and Sabra Townsend, Director of Operations, Jefferson Health Center for Autism and Neurodiversity.
Thank you very much, both Dr. Ross and Ms. Townsend, for being here. Please state your name and proceed with your testimony.
Good morning. This is Sabra Townsend, and I am the Director of Operations for the Jefferson Center for Autism and Neurodiversity. And there is Dr. Ross, and so she can introduce herself.
Yes. Good morning, Chairman Green and members of the Committee on People with Disabilities and Special Needs. As Frank said, I'm the director of the Center for Autism and Neurodiversity at Jefferson Health, and I'm speaking on behalf of myself and also the CEO, Dr. Klasko, and Sabra Townsend and I are both very excited and grateful to be here with you today. I think we have a quick video. I don't know will you be able to show it, Sabra?
If I am allowed to share it, yes.
Mr. Iannuzzi, is there any steps they need to take in order to do that? I think we did state earlier that they were going to be showing a panel, well, not panel, but a presentation as part of their testimony.
Both Dr. Ross and Ms. Townsend have sharing access, so they should be able to use that function within Teams to make their presentation visible to members of the committee and the public.
Thanks.
Okay, so you know what? While Ms. Townsend pulls that up, I will start speaking, and if we do not get to the video, I can certainly share that with the group later. Councilman Green, to your point, the Americans with Disabilities Act has been around for 30 years, and we read with great interest and were impressed by the scope of the work of the transition document to meet the physical needs of those with disabilities. And I think we just want to really highlight the point that you made, that although the Americans with Disabilities Act does, of course, apply to those with neurocognitive differences and the abilities to problem solve and communicate, and challenges with sensory environments and unexpected behaviors, there are literally no guidelines as part of ADA for this population, which of course made it challenging to have an ADA transitional plan that would include them in an evidence-based best practice manner. So in other words, of course, we know that this group should be included, and I am in fact working with Carousel Connections and with Parks and Rec on many of the processes that we're putting in to Parks and Rec. But at Jefferson, we feel strongly that there needs to be a model for inclusion and accessibility for these populations. And we at our center are striving to pilot different programs, collect evidence, and then we will be looking, frankly, to this council and others in political positions to help us advocate for the legislation of those regulatory guidelines once we collect evidence to back them up. I want to just add also that, part of our model includes asking shareholders and stakeholders what matters to them. We do that at the very outset of our projects. We also educate and prepare those with autism and intellectual disability, for example, for experiences as we create accommodations and education for those in the community. We measure outcomes and also hope to advocate for their implementation. We are hoping not just to create a legislative or regulatory difference, but to frankly change a culture. I mean, there has been a lot of talk and important talk about diversity over the past year, and we just need to keep in mind that diversity does include disability and includes all levels of disability. Lastly, in addition to programs and processes, we are working on the built environment. And part of the really amazing experience for us in being at Jefferson is that we have access to a school of architecture and industrial design. And we are consulting on our new medical pavilion to be both accessible by process, by having resources, accommodations, and education, but also by physical design. And we had an international symposium of designers and individuals from all over the world, and are also educating our students to be thinking about this. And while I'm not saying that we have the answers, we are starting to ask, we think, very different and relevant questions. One other thing that I'd like to add, and we'd love to share in partnership with this vision and mission with you, because we feel strongly that Philadelphia is a birthplace of independence, as well as has a reputation for, brotherly love and sisterly affection. And we would very much like these guidelines to be born in this center. So the other thing that I'd like to add, and this just came out literally within the past hour, is that we just completed a study. I just want to highlight how important this is. We just completed a study looking at data of over 64 million people who have contracted COVID across this country. It includes over 540 healthcare centers. And what we have found will shock you. It is that intellectual disability, as an example, as an independent variable. So we're not talking about those with intellectual disability that live with congregate healthcare settings. We're not talking about those with intellectual disability that also have diabetes or high blood pressure or obesity, although there is a higher risk of comorbidities in that population. We are talking just about those with intellectual disabilities who live in our community. IDD, intellectual disability, is the highest independent risk factor in this country for contracting COVID. And furthermore, it is only below age in terms of dying from COVID. So think about that. And lastly, if you have an intellectual disability and are hospitalized with COVID, you are almost 4 times as likely to die as another individual. These are sobering, this is sobering data, and this speaks to the importance of accommodating and thinking about these populations in our everyday worlds and in the medical care we deliver and in making things accessible to them. We have approached the CDC about adjusting the guidelines and have been, as of yet, not successful, but we are still hopeful in using our data, which has just been published literally within the hour, to help sway this prioritization. And when individuals with intellectual disability and with neurodiversity do come to our vaccination sites in the city and elsewhere, either because they have a comorbidity now or because hopefully they will soon be prioritized for vaccine, we are creating a toolkit which involves preparatory materials for them, educating our vaccinators, and providing accommodations and increased levels of access to this population at our vaccination sites. So while I'm here today to tell you something really sobering and scary about the conscious or unconscious bias of populations that are cognitively different, I'm also here to tell you that we have some solutions that we'd like to offer, to our city and to our communities to help promote their well-being. I don't know, Saber, if you're able to share the video. We just wanted to give you like a minute's glimpse into what it's like to have autism or an intellectual disability and to be waiting for an appointment.
I am not as familiar with Teams as I am with Zoom. Can you all hear do you see a video, and 2, can you hear the volume?
The video paused, and we cannot hear the volume. It was
Okay.
running, and it kind of paused.
Okay, hang on. Let me stop and find the optimized video.
If we are unable to share the video with you today, or perhaps we can try again after questions, because we know everyone's time is so valuable. But we will be working on a model for inclusion both across our community as well as our healthcare center. In terms of transition to adulthood, I just want to say a couple more things, is that most individuals with intellectual disability and autism do not get medical care once they graduate from pediatrics. And when they do get medical care, for example, in the case of autism, they are almost twice as likely to die inpatient as other populations, for any medical reason. So these are issues that need to be addressed both in our healthcare centers, but also for those of you who are familiar with my work either from Jefferson or prior to Jefferson, we have programs when things reopen with the sporting events and recreational centers. We have programs with the flower show, and our programs are lifespan in terms of both addressing developing skills and also employment. So Saber, I hear the sound. Is it working, do we think, or?
While Ms. Townsend is trying to bring up the video, I wanted to ask you, Dr. Ross, a couple of questions. I know you and my office have talked about opportunities for making City Hall more accessible for those that have learning differences. And that kind of ties right into the second priority of the city's ADA transition plan in reference to access to goods and services. So could you give some perspective on some of the conversations and some of the training you've put together, which is something that we will try to implement, especially in April, in reference to how the work you've done in other facilities. You talked about your work with the Flyers and some of the sports teams and making their locations and giving those that have a learning and physical difference access to some of those entertainment perspectives. By considering that access to goods and services is one of the priorities for the transition plan, and for City Hall, for many people, this building has a number of services that people need to access from various age categories. So if you could give a little perspective on that work that you've done in the past and also what you would like to do here in City Hall.
Yes, we're really excited to partner with you and City Hall. And what we have created is a visual storybook to prepare those with learning differences to come to City Hall. We just need to add, that was actually created pre-COVID, so we need to add some masking to some, and have a story related to that. We also are very hopeful about scheduling 3 different kinds of trainings at City Hall virtually. One, we'd love to meet with City Council members for a 20 to 25 minute training about autism so that they will understand their constituents who are affected by autism. We would secondarily like to train everyone else who works in the building because, of course, by the time you meet with somebody, they've had to, go through security and meet with your staffers. So we have a separate training for staffers. And lastly, we have a training for security. And we are prepared to deliver those trainings at different times of day and more than once to help capture as many people as possible. When I first started to do this, I was working with the Phillies and I met with their operating officer at Citizens Bank Park, and he said, well, I'm going to have you meet with our managers. And I said, with all due respect, sir, by the time a manager is called, there's already been a problem. And we are more than willing to train everyone here to prevent problems and to improve accessibility so that we are not reacting to an issue. Instead, we are responding to a need. And so with that, we trained all 5,000 employees and game day staff at Citizens Bank Park, and we continue to train their new hires every year. Furthermore, at Jefferson, we are training everyone who works at our institution, the doctors, the outward-facing staff, people who check you in, people who clean your room, people who bring you food, and security. And we are training inward-facing staff, those who do billing and other. Oh, here we are with the video. So.
I'm sorry, Dr. Ross. I didn't mean for you to stop mid-sentence.
That's okay. Do you think it's
okay?
Okay.
All right.
Jefferson Endocrine, can I help you? Jefferson Endocrine, can I help you? Yes, what time are you looking for? I have 1 o'clock and 2 o'clock looks good. Jefferson, can I help you? about 2? I got you. All right, Mr. Smith, talk to you later.
Alex, we're ready for you.
Thank you, Ms. Townsend. I hope that gave all of you a little bit of a flavor of what it's like to be neurodiverse in a new environment and anxious and overwhelmed and to have, issues with communicating.
Okay. Well, thank you, both Dr. Ross and Ms. Townsend. We'll open up for additional questions that members of council may have. We also look forward to those additional opportunities because what you are presenting is in keeping with what we heard from Ms. Ewing, continue to expand the work to make the city of Philadelphia and starting here in City Hall more ADA compliant for both those with physical differences but also learning difference as well. Seeing no additional questions from members of council, I want to thank you for your testimony this morning.
Councilman Green, if I may, my apologies for interrupting. We had a session or a section that discussed the parent perspective.
Mm-hmm.
And not to be the last kid in the class that asked that last question, I did want to also mention that I'm a parent of a young man with exceptionalities, with not only physical differences, but intellectual and neurological differences. And as a Philadelphian, raising him as a parent, I've often noticed in Philadelphia facilities, I know which ones have external fencing and which ones don't. When my son was young, that was the first thing I looked for, to see what kind of barrier was set up if he were to elope. And I know that the transition plan has very detailed assessments of different facilities, but as we talk about not only health and safety, but usage of facilities, parents are concerned not only about the physical safety of their young ones, and as they grow older, the level of activities that are available at particular city facilities. Also, the training of the staff is key. And I know that may not be specific to physical ADA guidelines, but as Dr. Ross pointed out, the guidelines certainly cover the neurological differences, the developmental differences, autism, learning differences, etc. There are no specific guidelines along those for those specific conditions. So it's left to staffing to understand how people interact with people who have differences. So that's the two main things from a parent perspective that I always consider. Health and safety in terms of the physical barriers around facilities, of be it fencing or the way that the facility is actually designed so that people can be safe when you speak to playgrounds and outdoor activities. And also the level of interaction and knowledge of the staff. Dr. Ross mentioned training the sports teams, the Phillies, the Flyers, etc. But we also need to look at comprehensive understanding, not only of Parks and Rec staff, but also the libraries, the museums. Essentially, any public-facing organization has to have an understanding when people have differences, be it the space, the lighting, their reaction to what's going on. So I did just want to mention those things from a family and a parent perspective.
And Ms. Townsend, thank you so much for that information. That was very important. Actually, I think there's an extra. May want to if you have a multiple, able to turn it off. But I think that was very important because the parent perspective is I think really ties into the priorities from an ADA transition plan. When we talk about entryways and access to goods and services, public accommodations, and other amenities, for a parent, they're thinking about these issues when they need access to any of these points that have been prioritized by the transition plan, not only for them as they are raising a child that may have these learning and physical differences, but also as their child gets older and they may not be there. How will their child who, trying to make children that have a learning and physical difference be a self-advocate? And the concern is, will they be able to navigate the city if the parent is not there or guardian is not there? And that's why these 4 points of prioritization is so important, because not only for a parent with a child, and you're trying to see, are there accommodations, are there goods and services going to be available, how are we going to enter different locations, but also how will my child enter these locations or access these goods and services or use public accommodations or other amenities when they become older and I may or may not be there with them. So thank you for providing that perspective as part of this panel. With that, I'd like to move into what is our final panel, and we are joined by Thomas Earl from Liberty Resources, Joe Mancini, and Eric Williams from Project Elijah Empowering Autism. We can go in that order.
Mr. Chair, I believe that Tom Earl will be arriving momentarily, but he's being joined today by Liam Doherty, also from Liberty Resources.
And I see Liam is, I believe, is already here. So we will, let's proceed with Mr. Mancini, and then Mr. Williams, and then we'll hear from Mr. Earl and Mr. Doherty. Okay. Why don't we, I think we're maybe waiting still for Mr. Mancini. I did see someone come in on his behalf.
I'm here, sir. I'm here, okay. Councilman Green.
Feel free to state your name for the record and then proceed with your testimony.
All right, I'm sorry. Give me 1 second. My computer's acting a little funky. About 2 seconds, I'll be ready to go.
In this COVID time, we're all dealing with technology issues from a lot of different perspectives. So,
it's been a challenge for sure. Yeah. Hi, everyone. My name is Joe Mancini. I am the executive director for KenCrest. KenCrest provides community-based supports to people with developmental or intellectual disabilities and their families throughout the age continuum, from newborns to seniors, adults throughout southeastern Pennsylvania. The city of Philadelphia, in all of its historic beauty, is not disability friendly. Many of the buildings and historic sites that tourists fly from all over the world to visit are inaccessible to people with physical, intellectual, and developmental disabilities. When we think about these barriers, we always picture the physical barriers. These visible physical barriers, such as, but not limited to, include lack of wheelchair accessible entrances, need for automatic doors, missing elevators, or signage that does not account for those with visual impairments can be seen throughout this city. Business owners who often cite the additional costs associated with these changes or the time and impact modifications would have on their customer base. The truth is, refusal to make these accommodations are often due to the invisible barriers we tend to ignore. The fact is that the community in general has had limited opportunity to interact with people with disabilities. The stigma associated with a disability leads to business owners creating or maintaining these physical barriers in order to encourage a customer base they're more comfortable with. Most biases are based out of fear of the unknown, fear of something different. We can help to eliminate these fears and create a bridge between individuals with and without disabilities through education. The model is effective. For example, I worked with a small group to train employees in the fashion district in Philadelphia on customer service when working with people with disabilities, along with general disability education. This introduced the staff to people we support and allow them the confidence to interact with this population. Disability sensitivity trainings like these would aid in eliminating the invisible barriers and encouraging people to assist with removing the physical barriers as well. Thank you for the opportunity today to provide testimony.
Thank you, Mr. Mancini. Let's move forward with Mr. Williams.
Good morning. Good morning, Council Member. Yes. Good morning, Council Member Green, the committee, and the viewing audience. My name is Eric Williams. I'm calling to testify in support of resolution number 210128. I am the founder of Project Elijah Empowering Autism, also known as PIA, is an autism foundation I created 16 years ago and based out of West Philly. PIA provides free year-round programs to families who are faced with autism and intellectual disabilities on a daily basis in underserved communities. Underserved meaning not offered in and not from ethnicity, geographical regions, or financial income. PIA always offers inclusion and diversity experiences in a judgment-free, safe, and nurturing environment. My reason for creating PIA is from my son, Elijah, who's now 22, who at the age of 3 was diagnosed with autism. Elijah is a product of the Philadelphia public school system. He graduated from High School of the Future and Drexel University's Project Search. So although Elijah and some PIA families continue to make progress, there are still some challenges that we face. PIA did an informal 2-year study focusing on amenities and resources while being away from your comfortable home environment. And some of those concerns that were addressed to PIA as an organization came back. There were amenities such as sensory zones, sharing handicapped seating, assisting living and visual on-screen technology while commuting on public transportation, businesses, and public spaces. In the essence of time, these are just a few of the resources that we could have in place that assist them during the ADA transition phase or plan. So my feeling is that it's better to be proactive rather than desperately reacting to an unfortunate occurrence. So this is the perfect time to stay ahead of the curve and make a difference. So P will be honored to participate in such a committee. And like Sabre Townsend, a great friend of mine, she's a parent, so we're also led from a parent perspective. And then all of our families, they participate in any kind of surveys and data to improve the quality of lives of individuals with intellectual disabilities. Councilmember Green, you and I sat in your office a few years ago. We talked about an unfortunate occurrence that happened while I took 65 families to visit the Smithsonian Museum and U.S. Capitol. And we talked about diffusing real-time situations to prevent anything and keep the safety of our loved ones out of harm's way. So with that, I'd just like to leave with this one quote by Dr. Cornel West, and it reads, "You can't lead the people if you don't love the people. You can't save the people if you don't serve the people." Councilmember Green, members of the committee, and viewing audience, I thank you for your time and in consideration of my testimony. Have a great day.
Thank you, Mr. Williams. I just received some information from Mr. Tom Earl that he's watching. I think he needs we're trying to connect him with the team's invite to get in. If we could take care of that. Are there any questions from members of the committee for either Mr. Williams or Mr. Mancini? Seeing none, I want to kind of touch base on both the 2 points that you raised, both Mr. Mancini and also Mr. Williams, regarding, and I want to focus more on the goods and services aspect. And I think that is a real challenge. And we can make the capital investments, and we spent a lot of time in the beginning of the hearing talking about the capital investments. And I think there were some great ideas and suggestions from members of this committee to give us as members of council more information about the investments that are being made through the capital budget and capital program that are tied to the ADA transition plan, so we can see that information as we're going through the budget process. But when I reflect on the conversation with Dr. Ross and Ms. Townsend, as well as both you, Mr. Mancini and Mr. Williams, and kind of gave some perspective, especially on both public accommodations, more specifically about goods and services, and you raised some of the concerns. What are some of the you've seen either through your members and those you've helped, either through Project Elijah or through ChemCrest, on the goods and services that the city is providing, and how we can do that in a way that's more favorable in keeping with the Disability Act. And we can start maybe with Mr. Mancini and then Mr. Williams. All right, we may have lost Mr. Mancini. Mr. Williams, if you could.
Councilmember Green, yes. Unfortunately, you are breaking up, and I missed part of your question.
So I was just talking about some of the experience you have raised, and I was saying with Mr. Mancini regarding the goods and services portion of the 4 priorities for the American with Disability Act, and how some of the individuals and advocates and other families that you've worked with through here, and some of the challenges they may have had. You talked, about the trip you had to the museum, but I'm just curious in reference to other information you've heard or seen from some families you've worked with regarding the challenges of accessing goods and services here in the city of Philadelphia.
A couple of examples. Some families, they visit like museums and the fashion district and so forth. Of course, this was all after COVID, but they found that in an unfortunate, overstimulating situation, they really had nowhere to turn to, just to kind of get them off of the main area, so they could kind of maybe get their controlled behavior, make it manageable. And when they went to like different staff, whether it be the fashion district or a government building, no one actually knew what to do and where to go. So the families, they felt like they were left out on their own to figure out what's best for my loved one during this unfortunate time. And there was just no clear plan of where to go, whether it be a restroom, a lounge area, a specific seating area. Elijah and I, going to Project Search, he had to catch a SEPTA. So while Elijah was looking at the on-screen visuals, there was a couple autistic, special intellectual disability families. They didn't know what to do on the bus. And although that wasn't the bus driver's responsibility, so just trying to be quick acting and proactive, I told him I pulled down the handicap seats. And while the bus was crowded, you can at least sit there and let your guardian oversee you for that duration. But their only option was just to get off the bus, or visiting, a museum, take them outside, or go in the bathroom and try to get them off the main floor, because they didn't want to cause panic to the other patrons. However, that's doing a disservice by us not being proactive about it. And like when we visit the Capitol, the Capitol Police didn't know what to do, so they just took us into a theater, as I mentioned to you. But that was all left up to me to get 60 plus people under my own control, and that was just from the trust of me bringing the group there. But no one actually knew and had any kind of plan in place like they would if evacuation plan was needed.
Okay, thank you. And I think Mr. Earl is in, but I want to ask Mr. Mancini to follow up on that question, and then after you respond, then we'll go to Tom Earl and Liam Doherty.
Councilman Green, if you could just ask the question again, I apologize. I'm having some technical difficulties on my end.
No problem. I was just asking questions in reference to the issue of goods and services. As we're looking at this ADA transition plan, we talked a lot about the capital investment, but also goods and services is an important point. And I think Dr. Ross and Ms. Townsend raised that, as well as Mr. Williams, and you also talked about that. And I was curious from your perspective, from the individuals you work with, what information they may have provided regarding challenges they've had in reference to accessing goods and services here in the city of Philadelphia.
So, we hear it from families. I've seen it myself. One of the individuals that used to work with me at the Arc of Philadelphia, our advocate, uses a wheelchair for mobility, and places like the Modern Museum of Art, he was having challenges navigating and ended up in a lawsuit as, you know, these well-known established entities that aren't wheelchair accessible, and fighting against those things and making sure it's happening. What I see often, what I hear from families often is, whether it's those visible or invisible barriers I spoke about earlier, that they don't feel comfortable accessing the community. It's safer to stay home. It's less of a challenge. There's less eyes and comments and whispers, or people that even attempt to intervene. When you see an individual, and I'll go to intellectual disabilities, having a behavior in the community, or even stemming, if you're relating it to an individual diagnosed with autism, those look like aggressive behaviors, or in some cases are aggressive behaviors that can be managed. And good Samaritans, quote unquote, or individuals in the business will either ask you to leave or attempt to intervene, escalating the situation, where the families that we support would rather stay home, and they're not getting that everyday authentic community experience because either they can't physically access, or once they do, people inside aren't trained or comfortable working with an individual or individuals with disabilities. So we're seeing a lot, but we're seeing less than we would because people are staying home.
And then when you think about the fact we're in this COVID dynamic and people are concerned, we had some earlier conversation regarding access to vaccines. I think that continues to even further isolate those that have a physical or learning difference. And we've been in a pandemic for now over a year, and that isolation just continues to grow. And that's something that we need to address. And that's why having this conversation regarding the city's ADA transition plan is so important. I'm going to have Tom Earl and Liam Doherty to testify next. If you could both state your name for the record. And then after their testimony, I know Councilmember Kendra Brooks has a comment. Mr. Earl, Mr. Doherty.
Step in here. I'm Liam Doherty.
Councilman, can you hear me?
I can hear you. I can just be a little bit, if you can speak a little louder.
Okay. I'm hearing other testimony in the background.
Okay. Why don't we go with you, Mr. Earl, and then we'll go to Mr. Doherty after you. Mr. Earl, if you could state your name for the record and then begin your testimony.
Yes. Good morning, Councilman Green and members of City Council. My name is Thomas Earl, and I am the CEO of Liberty Resources Center for Independent Living in Philadelphia.
And you can please proceed with your testimony.
Okay, can everyone hear me?
We can hear you. Go ahead. Mm-hmm.
Okay. Good morning. Thank you for the opportunity to testify about. Okay. Good morning. My name is Thomas Earl. The CEO of Liberty Resources. And thank you for the opportunity to testify about the transition plan. I have reviewed it and in detail, and it's wonderful that the city has finally completed this important process. With respect a couple highlights or concerns and also positive comments. It's evident that the transition plan does not cover the employment requirements of the ADA. It's said that because the city's HR practices are covered by Title I of the ADA, that is not entirely correct. The city is still, as a public entity, required under Title II of the ADA to comply with the non-discrimination policies of the ADA, including employment. And employees who work for the city have the rights under Title II of the ADA with respect to accommodation and hiring practices. Secondly, as a member of the city's Diversity, Equity, and Inclusion Committee and Advisory Board, I think it's important for the city to track and quantify the number of city employees that work for each department who have a physical or non-physical disability or intellectual disability. This should be, going forward, this should be part of the city's hiring practices and affirmative action to employ people from protected classes, and not just race, religion, national origin, but also disability. And this will help improve the diversity of our city when it comes to city government employment practices. Next, I want to note, I think it's on page 6, that the Board of Revision of Taxes, which is a very busy city department, was not included in the transition plan. All city programs, facilities, and services should be included in this transition plan. And given how busy that is with homeowners and who might want to appeal their property taxes, that should be fully accessible from a physical facility perspective and also a program perspective. I want to also give kudos to the city for the hiring of the ADA compliance director position in 2018. This added resource will help improve the city's compliance with the ADA going forward. And Liberty looks forward to working with the new director of the ADA Compliance Office, Ms. Ewing. Would like to point out another point in the transition plan with respect to facilities and programs. It's great that the city assessed 537 properties or facilities, but the priorities talk about priority one, that there be an accessible path of travel to the facility and into the facility. And this path of travel obviously must include sidewalks and curb ramps. And that's part of what the city is responsible for under Title II, including the Streets Department. There does appear to be a process or a link on page 12 for residents to request a sidewalk or curb ramp repair or installation. This needs to be a key component. I recall hearing at a public hearing from City Council a couple years back that more than half of the personal injury lawsuits against the city of Philadelphia involve people who have been injured on broken sidewalks and curbs and curb ramps. Moving on to effective communication. It is important that the ADA Compliance Office and the Mayor's Office for People with Disabilities improve the process where American Sign Language interpreters are provided at public meetings, city council committee meetings, hearings, and city council general sessions on Thursday. There have been a number of times that deaf staff from Liberty Resources and other organizations in the city have been excluded towards the end of a scheduled meeting because the meeting runs longer than people thought it would. When that happens, the meeting should end. Because it really is a violation of the ADA to continue a public meeting without effective communication towards the end of the meeting. The last point I'd like to mention is, in a positive, complimentary way, is the designation of a liaison, ADA liaison for every city department. I think that's important to help improve the inclusion of people with disabilities, whether they are constituents or fellow staff people in that department, and improve compliance with the requirements of the ADA. And I think the training that is provided to those ADA liaisons through either the ADA Compliance Office or the Mayor's Office are very important, and something that should be completed across all departments. And my final comment is also sort of included in the effective communication context of the ADA and the city's transition plan. And that is for the Philadelphia Police Department to adhere to, in every possible circumstance, to the use of a crisis intervention team when a 911 call comes in involving a person with a disability, including people with intellectual disabilities, autism, behavioral health, a communication disability like deafness, to make sure that when the police show up at the scene, that there is a trained crisis intervention professional who can help save the lives of somebody who might be in trouble. That concludes my testimony. Councilman Green, thank you very much for the opportunity to testify.
No problem. Thank you, Mr. Earl. Ms. Doc, I think you were next to testify. You can just state your name.
Good morning, Liam Doherty. I'm the policy and project coordinator at Liberty. Good morning, Council and fellow participants. My name is Liam Doherty, and I'm the Policy and Project Coordinator at Liberty Resources, Inc. Liberty is a federally funded center for independent living that works closely with residents with disabilities to promote life in the community rather than long-term care in nursing homes. As such, we have a large volume of complaints about structural barriers in our city, which amount to making it very difficult to maintain life in an integrated community-based setting. As was said multiple times today, the transition plan is long overdue. The ADA was passed 30 years ago, and the city of Philadelphia is fortunately now catching up with this benchmark legislation with the undertaking of the current transition plan. Also, as was said, 16% of Philadelphia residents have a disability, and it is essential that our people be provided the accommodations they need to enjoy our city in the way non-disabled Philadelphians do. However, this plan should not be thought of as simply a way to change and augment structures. The plan must be thought of as fixing a wrongdoing, of correcting an injustice that came from the original inaccessible bill. City structures and systems set aside private businesses must be compliant with for regrowth, not just to build back better under the pandemic, but more importantly to include the disability community in the reopening of our city. Indeed, other private and semi-private businesses will take cues from Philadelphia on valuing ADA compliance going forward. We need to show these entities that our city prioritizes accessibility and inclusion for its residents. In the actual transition plan, a more thorough explanation of the grounds of each priority area in specific cases needs to be given, and enforcement mechanisms need to be defined. Tom went into some of our other comments on the plan, and we did submit more thorough comments during the actual comment period. Budgetary shortcomings should not disrupt the finalized transition plan. We are all aware that Philadelphia faces some hardships in emerging from this pandemic. However, it is essential that the plan be carried out how it is written the ability of Philadelphians with disabilities to live in our communities depends on it. Thank you, Council.
Thank you, Mr. Doherty and Mr. Earl, for your testimony. I know Councilmember Brooks had a comment that you'd like to make. If there are any other comments from members of council, please indicate as such.
I just want to thank all of the speakers and parents and the providers that have been, sharing this information and talk about the challenges with where we're moving with this. But I also just want to recognize Mr. Williams. He reminded me of a place of understanding that when I couldn't quite articulate the question I had for the city around how we use these spaces, he came very clear and explained and experienced. And I think that that kind of adds to the questioning that I had for the city: who's at the table? And I just want to continue to push to make sure we have parents and service providers and actually individuals that have to use these services part of the discussion initially, not an afterthought. It should be part of the original discussion. So I want to thank you, Chairman Green, for just making sure we had a diverse panel, and I want to thank them for sharing their stories and continuing in this fight. This has been a long fight around ADA compliance in general, and we've come a long way, and we've expanded the scope of who's qualified within that. So thank you for this hearing, and let's continue this fight.
Thank you, Councilmember Brooks, for your comments and your participation in today's hearing, as well as all members of council. And I agree with you. This is a fight that we need to continue. We've made some progress, but we have a lot more progress to go. I'm thankful for all the witnesses that testified this morning. I think it gave the various perspectives on this issue, and some of the work that we've done and some of the work that we need to continue to address what you said, Councilmember Brooks, are continuing work to continue to fight. Are there any other questions or comments from members of the committee? Okay. Seeing none, are there any further questions from the viewing public? And is there anyone else here that would like to testify whose name I failed to call that wishes to offer testimony on the resolution being discussed today? Okay. Seeing and hearing none, I want to thank all the panels and witnesses once again for their participation today. We definitely value your opinions, and we look forward to continuing this conversation as the city moves forward with its ADA transition plan. Definitely feel free to provide comment and continue to provide suggestions to Ms. Ewing and the administration as they continue to move forward with the implementation of this transition plan. This concludes the public hearing of this committee. This concludes this public hearing of this committee. We can now recess this hearing until the call of the chair. I want to thank all of you for your attendance and participation on this very important issue and topic. Thank you and have a great day.